Finally, we'll learn more about the new Tele ICU capability at Novant Health via a virtual interview with Dr. Daniel Feinstein. Dr. Feinstein is a critical care physician with Novant Health's Tele ICU program.
Nice to see you.
Nice to see you, June. Thanks for having me.
Thanks. I'm so happy you're with us today. And I understand that you're a critical care physician at Novant Health. So tell me what that means.
Yeah, June, I'm what's called an intensivist. As you said, a critical care physician. I'm currently at multiple Novant facilities. And a critical care doctor basically takes care of patients who have organ failures. A lot of those patients are on life support, of course, and mechanical ventilators, and other forms of life support like dialysis, and when patients are having trouble with blood pressure, and they come and meet the intensivist doctors, and that's what we do.
So you take care of the sickest of the sick.
Yeah, that's exactly it, and that's regardless of what that organ problem is. Whether it could be a pregnant patient, it could be a trauma patient, it could be a surgical patient, medical patients. They all come for us to help take care of them.
Right, that's great. Well, I've heard reports that there's a national shortage of critical care inpatient physicians. Is that correct?
Yeah, this national shortage is it's not just the critical care physicians, it's critical care nurses as well.
Really?
And we've seen this coming along the way. Has a lot to do with our population growth, and then how sick these patients are. The good news is we're keeping patients alive a lot longer, and the bad news is that they do set them up for having infections and other significant health problems. And so Novant Health, we're doing our best to combat that shortage through means like of our new Tele ICU.
Mm-hmm. Well, we're here today to talk about the new Tele ICU program that's now available here at Novant Health Brunswick Medical Center. So I'm curious, will the new telehealth ICU program help with that shortage?
Yeah, absolutely. You're spot on. We have a shortage of ICU doctors. We have a large number of our community hospitals that don't necessarily have those specialists on site. And
right.
So we have our Tele ICU, where we have our Tele ICU critical care specialists and nurses able to work directly with our bedside providers to provide that same high quality health care with the specialty care that those patients need right there in their community. So this will help reduce transfer of those patients because we have the specialty care that they need right in their backyard.
Right. How does the program work? Let's talk about that a little bit. I saw some pictures of carts, and I think they were made by one of the NASCAR groups there. Tell me about those carts and the purpose of those.
Yeah, the Edward Haas team combined and partnered with Novant to come up with those carts. They're about 6.5 feet tall. There's a camera at the very top connected to a computer screen and a computer. And they're small enough to kind of get in the room. The cameras are pretty amazing in terms of the focusing. So the providers at the bedside are able to work directly with our tele physicians and tele nurses who are obviously doing this remotely in Winston or Charlotte to manage patients together who are critically ill. We've pushed out. We're going to end up pushing out about 120 cameras. We're getting closer to that number. We've been able to install these cameras at Brunswick Medical Center. Actually, it was one of our first hospitals that we installed it at. Very excited about that, as well as Rowan Medical Center, as well as Matthews Medical Center, Huntersville, Thomasville, Kernersville, and Mint Hill. So these are all of our community hospitals that really are probably the most impacted by the physician intensivist shortage that you spoke about.
Yeah. So these will really impact and benefit patients at smaller community hospitals, correct?
Yeah, that's absolutely correct. Those smaller community hospitals, again, may not have that critical care specialist on the ground. And so we have our tele-intensivists then collaborating very nicely with our bedside providers. We do this anyway on a daily basis, and why not just do it remotely? It works out quite well.
Okay. Tell me about where these physicians are. Are they in a hub somewhere, or are they in a hospital?
Yep, so great question. We have two bunkers. One is in our Charlotte area and one is in our Winston area. And
Okay.
in those bunkers, our larger bunkers in Charlotte, we have one physician who's a critical care specialist, and we're going to have three total nurses who are critical care specialists that are there. I want to just add on to, one of the things you stated earlier. These patients now, they can stay in their community hospitals because these specialists are available. And we think we can reduce transfers close to 40%. And it's not just, yeah, so that's great, right? It's not just the transfer is not safe sometimes for patients. It's certainly not a pleaser for patients. But we also know that this technology can reduce mortality, improve survivability by about 20%, and even shorten your stay in the intensive care unit probably by about 30%.
How about the nursing staff? Does this benefit the nursing staff also?
Yeah, absolutely. The nurses already, they're taxed to do a lot of things. And when you get a critically ill patient like this, as you can imagine, there's a lot to do. And so here we are, the tele-nurses can work directly with the bedside nurses. And in particular, we have a lot of alerts built in. We have the camera. So we're trying to also try to see, is there a patient declining? Is there something preventative that we can do to improve their outcome? So there's extra eyes, extra ears, as you can imagine, would also help out with their outcome.
This might be a stupid question, and I apologize if it is, but do you round on the patients?
Yeah, very, very good question. So we certainly handle acute changes in their status, right? But yes, our Teleteam rounds, just like we're in the room. We go through the labs, we go through the imaging, we talk to providers, we talk to nurses, we talk to families.
That's awesome.
Yeah. So we round just like we were at the bedside.
Wow, that is amazing. So the family can be included in this treatment plan and what have you.
Yeah, absolutely. And that's what we want. And it's amazing how receptive our family members are. I think they see the value. They love their bedside providers. Yeah, but they also say, here's some extra eyes and ears and who are going to help my loved one.
Yeah, well, I can tell you here, the folks in Brunswick County love to stay local. They want to stay in our facility as long as possible. And I think this is going to help them do that. And I think when the patient's families see how beneficial it is, they're going to love this program.
Yeah, no, and you don't have to tell me that because I'm already rounding on patients there in Brunswick Medical Center, and they love their hospital and they want to stay. And I can already see that their love for community and they're more comfortable there.
They're very invested in us and they love our facility. So this is going to be great for them. In this COVID-19 environment, will this be helpful and benefit those patients?
Yeah, absolutely. So this is going to benefit both COVID-19 patients, which it already has. We certainly have had, I think, an impact there, and also the non-COVID critically ill patients. Both of these patient groups are going to be benefited by the Tele ICU program.
How about success stories? Do you have a lot of success stories to tell?
Yeah, we have. And in fact, to be honest, I think some of our biggest success stories have come from Brunswick Medical Center.
Really?
Yeah, we've had several COVID patients who were so sick that even transfer would have been way too dangerous. They were on mechanical ventilation, some not on mechanical ventilation, but our critical care specialists were able to really help out our bedside providers with the mechanical ventilator machine and some of these, pretty complicated drugs and therapies that we're offering our patients. We've had patients very sick for weeks actually at Brunswick who we helped out, who actually walked out of the hospital, was very sick with COVID. Yeah, it's pretty remarkable. We've had a very sick patient who did not have COVID, had high blood pressure in the lungs, very complicated cardiac status, using a lot of very complicated drips of medications for the heart, and we participated in that patient's care as well, and she did well. So it's been really rewarding to see the benefit.
That's awesome. Well, this has been a great interview with you. I have so many other questions. I'm hoping I can reach out to you again and have you back on.
Yeah, I would love to join you again. It's a great community, truly, and I think that what we put together with the Tele ICU is just amazing and remarkable care.
It is. Well, again, thank you so much for taking time out of your busy day. I know how busy you are, and we so appreciate your time.
Thank you, June. You enjoy that weather out there.
You have a great day.
You too.